Now coming to the parameters or components of exercise program. So it can be broadly classified into the warm-up period, aerobic exercise period, and the cool-down period. So warm-up, the reason for doing warm-up is it helps to enhance the numerous adjustments that must take place before the actual physical activity begins. So it also helps to decrease the susceptibility of the musculoskeletal system to injury. So a good warm-up is very essential to reduce the risk of musculoskeletal injury. So physiological responses of warm-up are, it helps to increase the muscle temperature. It helps to increase the efficiency of muscular contraction by reducing muscle viscosity and increasing the rate of nerve conduction. So when the muscle temperature increases, the viscosity decreases and the rate of nerve conduction increases, thereby increasing the efficiency of the muscle. So it also helps to increase the need for oxygen to meet the energy demands for the muscle. It also helps to increase the circulation and also increase the venous return. So as the venous return increases, the cardiac output is further going. So coming to guidelines as to when you prescribe exercise program. So it should be gradual and sufficient to increase muscle and core temperature without causing fatigue or reducing the energy stores. So 10 minutes period of total body movement exercise or slow walking is recommended. Your idea or your aim should be to attain heart rate within 20 beats per minute of the target heart rate. Okay, so it should not be that fatiguing, or the heart rate should not increase to that level. You should have, the individual should be ready to actually go into the conditioning phase and not get tired in the warm-up phase. Next, coming to the aerobic exercise period. So it is the conditioning part of the exercise program. Exercise period must be within the person's tolerance. It should be above the threshold level for adaptation to occur. So this we have discussed in the principles when we were discussing. So in order to increase the endurance or to increase the strength, your threshold level should be above that for the adaptation to occur. And it should be below the level of exercise that evokes clinical symptoms. So it should be between these two thresholds. So it should be, the form of exercise should be sub-maximum so that the individual can sustain that activity for a long period of time. If it is near maximum or maximum, then the duration will have to be reduced. Okay, so that is the reason for sub-maximum. It should be rhythmic in nature, repetitive in nature, and it should involve large muscle groups. Okay, so there are 4 basic methods of aerobic exercise prescription. So we have continuous training, interval training, circuit training, and circuit interval training. So when we were discussing mode, I had told you that we will discuss 4 types of exercise program shortly. So these are the 4 methods of exercise training. We'll just discuss about this shortly. So continuous training is the same activity is done for entire conditioning phase. So say for example, walking, swimming, cycling, jogging. So same form of activity will be performed throughout the conditioning phase. That is the meaning of continuous training. Interval training, you have different activities that are performed in intervals. Okay, so there are 2 basic types of interval. One is called as active rest or active interval, and second is passive rest or passive interval. So as the name suggests, in passive rest, the person will be stopping that activity and resting completely. So he can either sit or lie down in supine, but there will not be an activity of any form during the passive rest. Okay, active rest on the other hand is the individual will continue to perform activity but at a much lower intensity. Okay, so that is the meaning of active interval. So it means the individual is not ready to actually go in for continuous training. He requires breaks in between. So those breaks can either be passive, wherein he is resting completely, or it can be active, wherein he is performing activity but at a lesser intensity. So he can get comparative rest. Okay, so that is the meaning of interval training. Then the next one is circuit training. Circuit training is you arrange a circuit or activities in series, and the individual will perform activities in series. So it says, suppose you have 5 stations A, B, C, D, E. After E, the patient will again start with the A activity. So that is activities arranged in circuit or in series. The next is combination of both circuit training and the interval training. So that is called as the circuit interval training. So to begin with, you can start with circuit interval training or interval training. And as the person's capacity or endurance improves, you can gradually minimize the intervals. So say from, you can start with passive rest if required, then go to active rest, then eliminate those intervals, and then gradually go to circuit training or continuous training. So that is how the progression is done. So this was about the conditioning phase of 20 to 30 minutes minimum. That should be followed by the cool down phase. So the purpose of cool down period is it helps to prevent pooling of blood in the extremities by continuing to use the muscles to maintain the venous return. So venous return is going to be essential in order to promote the cardiac output and replenish the stores of energy. So it helps to prevent fainting by increasing the return of blood to the heart and brain as cardiac output and venous return decreases post exercise. So that is why cool down is important, to increase the venous return. So it helps to enhance the recovery period or replacement of the energy stores, and it also helps to prevent myocardial ischemia, arrhythmias, or other cardiovascular complications. So cool down period is necessary for everybody, but it becomes all the more important when you are seeing any cardiovascular, any patients affected with cardiovascular ailments or even respiratory ailments. So the guidelines are more or less similar to the warm-up period. So the time frame for cool down is around 5 to 10 minutes as warm-up. And one more important thing that you should include in the cool down exercise is the stretching exercise. Okay. So because the muscle temperature has been high throughout the aerobic exercise phase, stretching is, cool down is a good phase to actually introduce all the flexibility exercises. So it becomes comparatively more tolerant for the patient, and you can also increase the extent of lengthening. So this was about the aerobic exercise program. So far we have seen the principles, FITT, volume and the mode of progression. And we have also seen the 3 phases of aerobic exercise. So you have warm up, the conditioning phase and the cool down phase. Now let's come to the responses to exercise. So we'll be discussing it in terms of cardiovascular responses and the respiratory responses. So first let's look at heart rate. So heart rate, it increases in direct proportion to the increase in exercise intensity. So as the exercise intensity increases, heart rate is going to increase in series. So until you're near the point of exhaustion. So when you reach the point of exhaustion, that is when you have reached the maximum heart rate. So that is called as your HR max. Okay. So it is the maximum heart rate that you achieve in all the effort to the point of exhaustion. So this is important. So all effort to the point of exhaustion will give you the HR max. So next is the stroke volume. So stroke volume increases proportionately with increasing exercise intensity, but it usually achieves its maximal value at about 40 to 50% of the VO2 max. Okay, so the further increase or the further demands are met by increasing the heart rate. Okay, so stroke volume will increase, but to a specific extent. Cardiac output, increase in heart rate and stroke volume will increase the cardiac output. We all know HR into stroke volume is equal to cardiac output. So improving or maintaining cardiac output is very essential to ensure adequate supply of nutrients reach the tissue, as well as the lactic acid and the other waste products are cleared quickly. Okay, so good cardiac output will ensure both the delivery of nutrients and the removal of the waste products. So for that, HR and stroke volume will increase. Initial increase, stroke volume will increase to a particular extent. The remaining of all will have to be compensated by the increase in HR. Next, coming to blood flow. So there is redistribution of the blood flow from kidneys, liver, stomach, and intestines to the exercising muscle. So when we exercise, there is sympathetic nerve stimulation, and there is redirection or redistribution of the blood flow from these organs to the exercising muscles. So in order to further increase the blood supply to these exercising muscles. So blood pressure, systolic blood pressure, it increases in direct proportion to the increased exercise intensity, whereas diastolic blood pressure will have a very little effect, or exercise will have a very little effect on the diastolic blood pressure. Next, coming to some of the components of blood. So first is the arterial mixed venous oxygen difference. So this difference increases. Okay, so because the venous oxygen concentration decreases during exercises, it reflects that there is increased extraction of oxygen from the blood for the use by active tissue. Okay, so oxygen content in the arteries is going to be more as compared to venous, but as the extraction from of by the tissues increases, this difference of oxygen content in the arterial and the venous this thing will increase. Okay, so when this difference increases, that means the tissue extraction of oxygen is getting better. Along with that, plasma volume will decrease. Because of that, there will be hemo concentration occurring. The blood pH will become more acidic, primarily because of the increased lactate accumulation with the increasing intensity. So these are the changes in the blood components. So these were the cardiovascular changes. Now let's look at the respiratory responses. So pulmonary ventilation, it increases during exercise up to near maximal rates of work in direct proportion to the body's metabolic needs. So as the body's metabolic needs increase, the respiratory system will have to push further and the pulmonary ventilation will increase. Okay. So at lower intensities, it is sufficient to meet the demands by just increasing the tidal volume. However, as the intensity increases, the RR will also have to be increased. Okay, so your minute ventilation is equal to RR into tidal volume. So initially there will be increase in the tidal volume, but as the activity further continues in duration or intensity, the respiratory rate will also go up. So that is how the minute ventilation increases. Alveolar ventilation across the capillary alveolar membrane, it increases to as much as 10 to 20 fold, okay, during heavy exercise in order to supply the additional oxygen which is needed and also to remove the CO2 and the lactate that is accumulated. So these are the changes, acute changes that are seen in the cardiovascular and respiratory systems in the after immediate exercises. Now let's look at what are the changes that occur with training. So suppose you train an individual for aerobic exercises, say for 1 month, 2 months or so. What are the changes that are going to occur because of the training? So we'll see these changes under cardiovascular, respiratory, metabolic, and the other systems. So with training, what happens is at rest, there will be decreased resting heart rate. So if you see heart rate of athletes, trained athletes, they will have resting heart rate, which is way less than say compared to a sedentary worker. So decreased resting heart rate, decrease in the blood pressure, increase in the blood volume, and increase in the hemoglobin level. So all these things will further facilitate the extraction of oxygen from by the tissues. So what happens during exercises with training, it helps in reduction of HR, increased stroke volume, increased cardiac output. So because the stroke volume is increased, the heart does not have to pump that high in order to meet the cardiac output demands. Okay, so that is why we have reduction in HR, increased stroke volume, and still the cardiac output is met. There is also increase in the extraction of oxygen by the working muscles. So this can be seen by the difference that we just saw, arterial mixed venous oxygen difference. So when this difference increases, that suggests that there is increased extraction of oxygen by the working muscles, and there is also decreased myocardial oxygen consumption. So all these changes are seen in the cardiovascular system with training. Next, coming to respiratory changes during rest. So the lung volumes increases. As lung volumes increase, the lung capacities will also increase. There is no much change in the tidal volume, and there is also increase in the diffusion capacity. So with aerobic exercise, regular aerobic exercises, these all changes can be brought about in the cardiovascular and respiratory system. So again, respiratory changes during exercise. So after say 2 months, 3 months of aerobic training, what happens is with exercise, there is increase in the diffusion capacities. So more oxygen is available for utilization at a lower physiological cost. The maximal minute ventilation increases and the ventilatory efficiency also increases. So this is the rationale behind why a regular aerobic exercise can also help people with respiratory disorders. So metabolic changes at rest, there is muscle hypertrophy seen, increased capillary density, which will again facilitate the aerobic energy systems that we saw initially. The size and the number of mitochondria increase, further increasing the energy production. There is improvement in the capacity to generate ATP aerobically, and the muscle myoglobin concentration also increases. So as we have seen partly in the energy producing systems, all these changes that are occurring with aerobic training will further facilitate or further augment the energy production and utilization. So metabolic changes during exercise, there is glycogen sparing, there is increased capacity to mobilize and oxidize fat, which we want, and also lower blood lactate levels. Okay, so this is again evident because the same activity can be performed at lower physiological cost. Okay, so with proper training, the same activity can be performed. Other systems that can be seen for are there is decrease in the body fat, there is decrease in the blood cholesterol level and the triglyceride levels, there is increase in heat acclimatization, and there is increase in the breaking strength of bones and ligaments, and also the tensile strength of the tendons. So in turn, it is going to help the musculoskeletal system as well. So aerobic exercise, as we saw, is having positive effects on many systems. So cardiovascular system, respiratory system, musculoskeletal system, and so on. So now just let's look at some benefits of aerobic exercises. Aerobic exercises play a pivotal role in prevention as well as management of majority of conditions like coronary artery disease, obesity, dyslipidemia. So we just saw it has effects on the triglycerides as well as the cholesterol levels, hypertension, anxiety and depression, diabetes, cancer. So it has a wide application. So it not only reduces the risk of developing these disorders, regular aerobic exercises also remains the mainstay of treatment for many of these disorders. There are many studies which have shown aerobic exercises having positive effects in case of breast cancer patients. So it also helps in instilling a great or a general sense of well-being, and regular aerobic exercises has been shown to have the potential to increase your lifespan. So there are certain studies which claim to have increased lifespan because of the regular aerobic exercise program. So I hope this was just a short or brief introduction and we just saw about some basics of aerobic exercises. I hope it has helped to solve some of your doubts. So these were the references for today's lecture. So I have referred Kistner, ACSM guidelines for testing and prescription, Milmore and McCardle. Thank you.
That was indeed an interesting and mind-boggling session. So that brings us to the end of today's session.
Yes.
Thank you so much, ma'am, for being with us and giving us your time.